Good evening. Mi naitwa Dr. Nzioki, karibu Doctor's Practice. Najua mlikuwa mnatarajia kuona Jimmy amekaa hapa. Leo ameshikana kidogo, kwa hivyo namshikia briefly. Doctor's Practice ni show ambayo mmekuwa mkitazama kuanzia mwezi wa February hivi. Kuna a couple of episodes mmeona, and our objective really ni kuwezesha general public wa interact with information about health from different perspectives. Kutoka perspective ya daktari kama mimi, kutoka perspective ya nutritionist kama fellow, na kutoka perspective ya senior nurses kama kama Karo. Kwa hivyo najua sato imekuwa mrefu, uko hapo na kikombe ya chai, uko hapo na juice yako. Keti vizuri, leo tunataka to recap a few things. Over the past few episodes kuna a lot of information tumeshare and tumepata feedback from listeners. Wengine wako na maswali, wengine wanasema tafadhali kuna ile kitu yenye fellow alisema, tunataka aseme tena, tunataka elaborate. Sasa ndio objective ya hii show yetu ya leo. So, kwanza kabisa, maybe Karo tuambie, reproductive health issues ni gani? What are the reproductive health issues? The commonest.
Oh, okay. So thank you so much, Dr. Nzioki. Now, reproductive health issues are very many, but the commonest ones that are there, we'll talk about both for the male and for the female. So tutaanza na the female, and for the female we have infertility. That is one, hiyo ni kitu moja ambayo inasumbua women, especially of reproduction. Then we have fibroids, we have miscarriages, we have stillbirth, we have so many things in relation to that. Now for the male, we have impotence, we have erectile dysfunction, so we have things that are related to that. I'll also give Felix a chance to also ingilia.
Achangie.
Yes, achangie, so that you can continue. Yes.
Maybe nikiongezea jinsi Kara alivyosema, female either male, they have reproductive issues. So she has, amesema most of them. Kuna ovarian cancer, vitu kama hizo, prostate cancer in men. There is also the poor sperm counts.
Sperm counts, yeah.
Yes, also just low sexual drive in women. Ni issues mingi too that touches both sides.
Okay.
Yes.
I think also with menstruation, there's also issues in regards to menstruation period, either prolonged periods or very painful. Again, it could also be very short periods, yeah? We also have endometriosis, which is there, yeah? So all these are part of reproductive issues. Yes. Yeah.
Na I like venye mmeiput, unajua mostly I think for most people tunaonanga reproductive health issues affect women only.
Yes,
lakini pia wanaume wana affectiwa.
Yes.
But I think one of the saddest things ambazo nimeona in practice is wanaume hawajuangi mali waende.
Yes.
If you have a reproductive health issue, unaenda wapi? Utaenda kwa gynecologist, utaenda kwa obstetrician, utaenda wapi?
Yes.
It's a big challenge.
It's true.
And I think men also over time, is it stigma? I don't know.
Also
stigma
culture. I think it's culture. That our culture almost portrays that the man cannot have an issue in regards to sexual, reproductive. Whereas the woman is always yeye ndio kwamba yeye ndiye anaweza kuwa na shida yote in regards to sexual reproductive system. Yes, so I think it is important for us to know that this can affect both genders.
Both genders.
Yes.
Yeah, that's why, Daktari, I tend to advise more men also to see a gynecologist. Because unapata watu wameweka reproductive system is all about a female going to a gynecologist or to see a specialist. So Naweza advice wanaume, just come out whenever you feel something haiendi vizuri. You feel you are not right in a way. You have started seeing some organs protruding. Maybe you're protruding breast.
Yes.
Unamea breast. Ndevu imekataa kutoka. Au function vizuri pale kwa nyumba. Usijivumilie useme acha nione vile kutakuwa. It's good end up here uone mtaalam pale hospitali uweze kusaidiwa ndio aswa ajue chanzo ni nini mapema.
Very true.
Okay. Ume mention about culture.
Yes.
And reproductive health issues mostly imeonekana, it's like a taboo.
Yes.
It's like
You're
a
not even
taboo, and
supposed to speak about it.
kitu yenye miujuliza hata labda nikiwa mtoi ama ukiwa mtoi, who spoke to you about reproductive health issues? Ama ulikutana nazo kwa soko, kwa mathri, kwa radio. Do we have a responsibility to discuss reproductive health issues with our children?
Yes.
At what age should we start? What content is relevant kwa umri gani? Because I think ni muhimu. Unaona mtoto yuko 5 years old, wanaanza kunotice there's a difference between me and the girl.
Yes.
Is that the right place to start? I don't know.
Maybe if well, I don't know if there's exact right time to talk to your children about reproductive health or reproductive issues. If you read books, zitakwambia kwamba the teenage years is when you're supposed to start talking to your children. But I believe right now wale watoto ambao tunadeal na hao si kama generation yetu. I think maturity level has gone high. There's the TV which is showing everything. Our children are learning from even the older children. As you have mentioned, like sisi tukigrow up, it was a taboo even to
ungeuliza
you can't. Yes. If you even see something on TV, you switch it off very fast. But school, I think now when we went to school, there was all this talk in regards to you growing up and becoming a lady. And I think it's very important, even from 9 years, for us to start discussing this topic. Because for sure you can see that not just the girl, but they will notice kuna difference between mimi na ule mwingine ambaye hatufanani. Hata saa zile unawaosha, you can't just be washing them together until teenage years, because even at some point you need to start separating, and you tell them now you're a girl, you're a boy, you can't just be showering together. Yes. So it is
the socialization.
Yes.
Maybe nikiongezea daktari, kwangu naweza sema kuwa it's a responsibility ya mzazi kutunza yule mtoto jinsi navyo ipasavyo. In my own opinion, I would advise as a parent you need to know how to package information unapatia mtoto or advice ile unapatia mtoto about the sexual health. And it should start as the moment when a child start playing with their peers, because the society imekuwa brought up in different ways. Labda sisi ni Christian, we don't know those things. There are other people who don't care. They don't care about the content the child is watching. So a child anafaa kujua when something is wrong about the sexual life, they should know this, my child, don't do this. Then when a child reach around 9 years of age, sasa kuna ile information unaweza impact. Mom, puberty ni stage. Now the child learns, and that's better. I think now how we package it matters a lot.
And maybe something, something I need to add, with whatever we are eating, it's making our children grow so big that people think they're actually mature. Yet they are very small. So you find a 9-year-old, someone is looking at a 9-year-old like this is a mature girl. So as Fellow says, it is very important just to follow your kids, be their friend as much as you're a parent. Talk to them, let them also tell you all these things that they're going through. Yes.
Okay. In practice, where mwenye you're primarily in reproductive health.
Yes.
On average, how old wasichana siku hizi, when do they get their first period on average, what you've observed?
Kitambo, I would say from 14 years, but currently as early as 9 years.
As early as 9 years?
Yes.
Kwa hivyo kama uko na 5-year-old hapo nyumbani, the clock is ticking.
Yes, it is.
Develop strategy. Jua utaongeaje na mtoi wako. Hii time ya kuaibika because kama wewe uongei na yeye pale
Somebody
Facebook
else will do it.
wanamuongelesha.
Yes.
Pale IG wanamuongelesha. YouTube influencers wanamuinfluence. So you need to choose who's going to influence your child.
Yeah.
Is it you ama ni socialites?
True. Very true.
Good. Tukiendelea, fellow, ulikuwa umemention male reproductive health issues. Na ulikuwa umeongea about erectile dysfunction. Na venye show imekuwa ikiendelea, that's one of the things that watu walikuja wakasema, fellow alitajia hiyo kitu vizuri. Anaweza rudia na explain.
Actually, daktari, erectile dysfunction is one of the diseases, I can tell you the diseases or a disorder that most male are suffering with. Silently. And it's really breaking families or even affecting their social life. Because once you can't function in your house, unapata you won't feel wewe ni ndume.
Self-esteem.
So unapata everything, social life and everything will be So generally it can be caused by several things.
Yes.
And in this, most likely, we have obesity issues. And obesity comes in with the fat accumulation that prevent the circulation of blood for full erection. Now we have the cardiac issues, shida za moyo, ama shida za pressure pale, kwa sababu zinaharibu zile mishipa za damu, za kupeleka ile damu. Apart from you, yes, kuna pia lifestyle, what we eat tend to affect our hormonal, general hormonal function. Pia kuna how can I call it, depression.
Yes.
The mental aspect of it.
Yes, and I always say, in a sexual life of every man, a woman plays a major role. Now, alcohol and drug abuse also plays a very major part in erectile dysfunction. So because like tobacco tend to harden the arteries or nerves za mtu. Na tumesema for full erection you have a sufficient blood flow. So tobacco does that, alcohol also impairs your hormones and several other things. So I will say for erectile dysfunction ni vyema ama ni vizuri ujiangalie. Chukua hiyo nafasi uende uone mtaalamu, daktari pale, umwelezee. Na kwa mtaalamu kuna jinsi ambayo erectile dysfunction inasaidia. Kuna ile daktari atakuangalia. Na kuangalia kuna zile assessment atafanya kulingana na maswali atakuuliza kuona haswa ni nini itaileta. Apart from that, kuna zile blood test atafanya kuangalia kama ni cholesterol inaleta hii shida, ama ni sukari ama ni hormonal. Na pia apart from hiyo kuna aina mingi ya test kadhaa daktari anaweza fanya pale kujua. Basi chanzo ikijulikana inafaa itibiwe. Na kutibiwa ni jinsi tunavyoweza. Kama zile nerves zimeharibika, basi tunaweza weka there form of implants. But hizo zinafanywa na surgery huko. Pia kuna kutumia pump, but some of them we don't have. So that to help you use a full erection. Apart from hiyo pia kuna madawa. Na ina madawa zile unapata hata kwa pharmacy tunazipata. But shida ambayo iko ni watu wengi wanachukua hizi madawa without prescription. Kwa sababu ujui labda tu au kufunction juu ulikuwa na stress. Unaenda kuchukua ile dawa. So hizi medication they tend to relax zile muscles of zile penile ama ile uzi yetu. So that kukuwe na sufficient blood flow. But remember, there is something that helps you to be fully erect.
Good. Hapo kwa dawa kuna opportunity ya kueducate public. Unakuta watu wanaulizwa hata ukiangalia YouTube videos a common question, how long should it last? How long should it last?
I think also kuna a lot of pressure. There's a lot of pressure from either the internet, your fellow colleagues or your fellow mates. And they're telling you, I do this, so you put a lot of pressure. So you're putting a lot of pressure. Also, you will find there are people who've actually been molested when they were growing up. And so they have psychological trauma that needs to be addressed. So probably you too counseling kidogo, motivation kidogo, and then it addresses the issue.
So I guess as we wind up here first session, I guess the most important thing tunaweza sema ni it's important to angalia the underlying issues. Don't just walk to the pharmacy, chemist, pop a pill, ama beshte yako ametoka New akakuangalia akakwambia
Amekuletea.
kuna hii mpya.
Tumia hii.
Tumia hii. As opposed to that, go seek a professional help, underlying issue ijulikane.
Yes.
Because actually one thing ambayo imeonyeshanwa ni sometimes erectile dysfunction is sometimes the first symptom of heart issues which may be coming down the line.
True.
Yeah. Kwa hivyo tutafunga na hiyo.
Yeah.
Kama hiyo kikombe ya chai iko empty, enda uongeze. Kama unasikia show imekuwa moto sana, look for a cold drink. Tukirudi tunaongea about pregnancy.
Yes.